also I'd like to welcome Dr. Kiphire, Joint Director Planning, Department of Health and Family Welfare. Thank you, sir, because we know how being interested in this profession, and also we've been a constant touch with our team and providing a lot of inputs. Whenever we reached you, you have been a source for us for supporting this program. Welcome, sir. And also Dr. Akyo, Mission Director in NHM, Department of Health and Family Welfare. Thank you, madam, because I know we met last time and your inputs were taken, and this mobile medical unit has been great impact with the beneficiaries. Thank you a lot for your presence, ma'am. And also I want to welcome Mr. Deva Pandya, Deputy Vice President and Lead CSR and Sustainability Tata AG, General Insurance Company. Thank you, Devan, for your time, because I know last week I told, and in spite of his busy schedule, he made sure that he will be there, because he is one person committed to this program, and also given a lot of inputs and taken forward to his management and his governing body. Thank you, Devan, for your continuous support and your management and governing body for making this program much more impact and way forward. And I also want to thank our partner TA, Nikhilo, a true inspiration to the community. Without your support and without your team support, this has not happened. I welcome you and also Gracie, Manpang and other team members. It's a great pleasure and we will strive forward. And also other government officials from PIT, Zenbeto and Kiphire and state team, all welcome, and my colleagues working from all the way, Reshmi and Raji and Ram Babu, who's a partnership lead. He's the one who connects everybody. Thanks, Ram Babu. So thank you, sir, for welcoming and also giving an opportunity.
We are a part of the Tata Group. The Tata Group was founded about 157 years ago, and Sri Jamsetji Nasubanji Tata is the founder of the Tata Group. And his quotes, I quote him, he said that in a free enterprise, the community is not just any other stakeholder in business, but is in fact the very purpose of its existence. And this philosophy continues to guide all Tata companies in their business as well as CSR endeavors. As per the Companies Act, corporates are required to draft their own CSR policies and to put it in the public domain. So for Tata AG, it's a two-pronged approach, caring for people and caring for the planet. Under caring for people, we have education, healthcare, rural development and disaster response. And under caring for planet is environmental sustainability. So our initiative is under the healthcare CSR theme. And the geographies are, apart from being proximate to business operations, you reach out to the underserved areas, states where Tata AG is the lead insurer, as Dr. Kika mentioned, across rural urban areas. And we have identified certain key communities, including the scheduled caste and the scheduled tribes under the Tata Affirmative Action Program. So this is just a visual representation of the 5 themes that we just spoke about. As I was mentioning, under the Tata Affirmative Action Program, those who have been historically disadvantaged, so those key communities, including the SC, STs, persons with disabilities and women from marginalized communities, there is a special focus to serve them under the pillars of education, employment, employability, entrepreneurship and essential enablers. I'll walk you through some of the key initiatives which has relevance to this region. Scholarships under the education, one of the flagship initiatives, where bright girls who study in government schools, we fund the entire undergraduate education in premier institutes of the country, including IITs, NITs, AIIMS, government medical colleges, government engineering colleges. As we speak, sir, in this financial year, about 327 such girls, 2/3 of them, 66% are from the Northeast. And on the graph, you can see the maximum being from Assam, Arunachal, Manipur. We also have 5 students from Nagaland being supported. They are studying in different states of the country, in different colleges. Again, a large part of it are tribals. About 58% are studying medicine. The balance is engineering, and the breakup. So 11 of them are in AIIMS, 36 in IITs, 85 in NITs, 179 in government medical colleges. And we also have the senior leadership of the company volunteering their time to select these students. So we have an NGO partner with shortlist, and then right from the chief investment officer, the chief operations officer, the CHRO, the head of legal secretary, all of them volunteer their time to select these students. Again, in the Northeast, we have a competitive exams coaching for NEET and JEE. This is being done in the PM Shri Jawaharlal Navodaya Vidyalaya School, in the central government school. It's happening in Kokrajhar in Assam. So there are 40 students per year in 11th and 12th, and these are the results. They have appeared for the JEE mains. So out of the 17 students, 3 of the students have scored above 90 percentile. And we are hopeful that they will get admissions in very good colleges. Similarly, in Kohima, ma'am, this year we began in the PM Shri JNV Kohima School. Again, similar coaching project. They are still in standard 11. And the last time when we had visited here, as a part of the inauguration of MMV, we had a CFO and we had handed over the digital computing devices to the students that will be used batch on batch.
Mobile medical unit was started with a vision to reach the populations living in remote, difficult areas and those communities cut off from main health services due to geography and climatic conditions. MMU represents significant made by the Ministry of Health and Family Welfare to reach such marginalized population. To share the universal health coverage, proper planning, strategy of MMU services will go along in meeting the challenges. As we all know that there are 11 functional MMU in the state of Nagaland, provided with MMU GPC, manpower, doctors and nurses, etc. But at present, if I'm not mistaken, there are only 5 are functional. That is Kohima, Mukokchung, Dimapur, Wokha, and Sinokoto. Advertisement for the post of other MMU MOs, but so far there is no applicants, no takers. The reason we don't know, maybe because of the low salary package. Each MMU is directed to conduct minimum of 12 games in a month. The deployment of MMU should be prioritized in these areas or villages where there is no functional health facility. The ASHAs and the VHSNC, that is the Village Health Sanitation and Nutrition Committee, should carry out the function of community mobilizations, ensuring that people who need services are informed of the MMU schedule. The Department of Health and Family Welfare has an MOU with SOSTI and Tata AIG for implementing the MMU activities in Symbolic district. So in a similar way, the SOSTI and Tata AIG group will be carrying out similar activities at Kiphire district by providing MMU vehicle and work in collaboration with the MMU Kiphire team. And our CMO Kiphire is also here with us. So the Chief Medical Officer Kiphire is requested to coordinate the planning and scheduling the MMU activities in the district. The CMO being in charge of the health activities of the district, SOSTI and Tata AIG shall work under the directives of the district health officials and the planning of MMU games, sharing of activity, data, etc. So as we launch the healthcare intervention through MMU and social protection intervention, we are hopeful that it will play a vital role in addressing the health challenges and uplifting the community. So with these few words, I once again wish you all the best. Thank you, God bless.
And received a specialized care through the support of entrepreneur associates. And I think some treatment cost was 2,50,000. So this is fully covered in insurance scheme. So that is the immediate impact story we can see in our intervention. So same another case story. So a lady, I think from 28-year cultivator from Peg district. So her annual income is very meager. So before, I think during her childbirth, so her family feared what is the financial cost and hospital care. So they are also displayed. Then I think she mentioned thanks to PMJY scheme, where she was admitted in district hospital Peg, and the treatment cost is worth 25,000 was fully covered. So these are some of the live examples through this intervention. And this is about our mobile medical unit intervention in St. Juniperton Peck district. The goal of the project is promote preventive healthcare among poor and vulnerable communities who have no access to primary healthcare. And the objectives is enhance access basic health and welfare scheme, community health awareness campaigns, regular health screenings and provide treatment, and also promote healthy lifestyle practices among the community members. Treatment linkages. If it is beyond mobile medical unit team, what we said that they are referring to nearest primary healthcare centers or tertiary care centers, if any.
For us to be able to achieve it, it was because of the department support. So thank you so much. That was, I think, for me, the respect for the government and the work that they are doing. It has really gone up a high, another level because of this work that we could achieve collaboratively. And I also want to acknowledge that the targets that were given by our partners and our funders, they were of course sometimes very difficult, but I think our team, having worked even at odd hours, made it possible. And one thing that we learned, and I feel that even going forward, that can be a best practice that the state of Nagaland can take forward, is we worked at the timing of the grassroots community, because we found that working at our convenience, which is 9 to 5 or at a working time, it makes it very difficult to reach our target. So we had to navigate all these challenges and work at times which were inconvenient for us but convenient for the community. And that was the reason why we could achieve our targets. So this is a humble suggestion that I want to give to the department also, and to people who are to the August gathering here, that I think if we work along the lines of the community, because many a times we wanted to visit the villages, they had festivals or they had other meetings where they could not have us in the villages, but we realized that working in tandem with the community and getting their timings really helped us in getting our targets achieved. And as we all have been sharing in the table, that it's a collaborative initiative to take the society forward to help our community members. And I know that we may have whatever difficulties that we have to navigate eventually, but I feel that at the end of the day, we are all trying to help our people in the villages and reach out the last mile community. And indulge me a few minutes by just letting me share one story. On Sunday, we were devastated because we heard the news that my former driver, who was also associated with our organization, the Entrepreneurs Associates, he committed suicide. That was on the 23rd. And the reason being that he was diagnosed with a severe case of problem with his gallbladder. And this was the cause of death in his family. About 3 of his previous family members had also died because of this problem. And upon getting that diagnosis for himself, he had left us a long time ago, but on Sunday he decided to take his own life and ended his life. For me that was something that was, it was a very difficult time for us to actually understand why he took such a drastic measure. But in the village where he was staying with his family, he must have thought that it is so difficult that there is no help, no support system for him, and because of which it is better to end his life. So at times, even at the Entrepreneurs Associates, with the sort of demand on the numbers that we needed to give to our partners and different kinds of challenges, it was difficult, and at times we also questioned whether the work that we were doing is meaningful, worthwhile or not. But listening to these kind of stories coming in from the villages where people have no hope, I think our work really matters. So I feel that whatever work that we are doing, no matter how small or insignificant it may be, just to get one person enrolled for a scheme, I feel that we must continue to do. And for me, I feel that our partners, Swasti, as well as our partner funders, Tata AIG, as well as the government of Nagaland, my humble request is this kind of work must continue so that we spell hope to communities in areas where there is no hope.
Several villagers recounted how certain private individuals and companies had approached these communities with promises of scheme enrollment, charging fees for the services. Eventually, without delivering on their commitments, leaving the communities disillusioned and wary of similar initiatives. This made our job significantly harder. Our team was met with skepticism, distrust, and even resistance. Another challenges observed were that of the terrain and accessibility issue. Navigating the difficult terrains of Pek and Zoniboto district tested our physical endurance and patience. Many roads leading to the most remote villages were in such poor condition that vehicle breakdowns became routine. Often in the midday heat or in the dead of night, miles away from the help. On multiple occasions, our team member had no choice but to walk for over an hour and a half just to reach their destination. Another challenges observed were that of the power and network disruption. A very frequent challenges was that of the prolonged power outage, sometimes lasting up to 5 days or even a week, leaving our devices dead and cutting off communication with the rest of the team. Without access to electricity, essential operations like data entry and beneficiary verification came to a halt, significantly slowing down the process. In some villages, we had to relocate or move to other locations because of the poor network connectivity or prolonged power outage hindered the registration process. The incident highlighted the urgent need for alternative power solutions such as power backup or multiple SIM cards for better network accessibility. Recognizing these challenges, we adapted our approach to ensure smoother implementation and stronger community participation. First and foremost, restoring trust and addressing misinformation. We engaged respected local leaders such as the church leaders, village councils, and even youth representatives to advocate for the project. Their endorsement served as a powerful tool to break down resistance and restore confidence through house-to-house visits, community meetings, and interactive storytelling. We dispelled myth and highlighted real-life success stories of families who benefited from these health schemes. Another strategic action taken was that of the adapting to local realities and community-centric approach, which Ma'am Nekule have highlighted. Recognizing the agricultural routine of communities, we tailored our outreach efforts to align with their schedule. Registration drives and health camps were strategically conducted during community gatherings, early morning or late at night, times when people were free from tending their fields. Additionally, organizing sessions around church gatherings, youth services, village meetings, and festivals encouraged further participants and fostered stronger community engagement. Another step taken is that of the leveraging partnership. Collaborations with the Nagaland Forest Management Project, Crystal Foundation, and other grassroots organizations further strengthened our efforts. Local NGOs provided logistical supports, while district officials played a vital role in establishing credibility. Given the project target-based approach and limited time frame, we also witnessed the commendable dedication of doctors and nurses who voluntarily provided their services, further driving the initiative's success.
The MMU team conducted a free medical camp and SP enrollment in our community. During the camp, I was diagnosed with migraine and hypertension, and I received the necessary medication and medical advice. The team also provided valuable health awareness which has helped me to understand how to manage my condition better. I am truly grateful to the Tata, AIG, and NHM, Swasti, and Entrepreneur Associate for bringing essential healthcare service to our doorstep. Their support has made a significant difference in our community, ensuring that the people like me receive timely medicine care and information. Thank you for your dedication and service. Thank you all.
MMU services envisage to be the technical and service quality standards for the primary healthcare through provisions of suggested package of service under 12 thematic areas, which includes the maternal health, neonatal and infant health, child and adolescent health and reproductive and contraceptive services, management of chronic communicable diseases, management of communicable diseases and basic OPD care, management of common non-communicable diseases, management of basic mental health, dental care, eye and ENT care, geriatric care, and emergency services. MMU in Nagaland has been an important initiative to enhance primary healthcare access, particularly in remote, hard-to-reach and underserved areas, by providing essential healthcare services to the communities that are difficult to reach due to geographical barriers and inadequate infrastructures. MMU offers a range of benefits to healthcare delivery services in Nagaland, particularly in addressing the unique challenges posed by the state geography and population distribution. Here I would like to highlight some of the key benefits of MMUs in Nagaland healthcare system. 1. Increased access to healthcare by reaching out to the remote villages and communities, providing essential healthcare services where traditional healthcare facilities are lacking or is too far away. Thus, ultimately reduce travel burden by bringing healthcare services closer to the people, thereby minimizing the need for the patient to travel long distance, which can be a significant barrier to accessing the healthcare. 2. The comprehensive healthcare services focuses on preventive healthcare measures which help in early detection and management of health issues, ultimately leading to better health outcome, which we have heard a testimony from the patient himself just now. The MMUs provide timely medical attention or immediate care for the minor emergencies such as injuries or acute illness, reducing the need for patient to wait for a long period before receiving the treatment required. MMU also act as a rapid response unit and quickly mobilized to provide necessary medical interventions and support to the patients. MMUs often include health education as part of their services, raising awareness about hygiene, nutrition, disease prevention, and healthy practices. It also supports services to vulnerable populations and play a critical role in preventing antenatal and postnatal care, vaccination for the children, and family planning services, thereby improving maternal and child health indicators in the underserved areas. MMU helps in lowering overall healthcare costs for communities by preventing severe health issues through early intervention and reducing the need for hospital visits. MMU is a vital component of the healthcare delivery system in Nagaland, addressing barriers to access to primary healthcare, improving health outcomes, and fostering community engagement in health, and has definitely contributed to the better health indicators in the area they serve. Hence, the MMUs in Nagaland represent a vital strategy in addressing healthcare disparities in the remote regions. Healthcare is a fundamental right, and yet, in many areas, access to essential medical services still remains a challenge in Nagaland. Therefore, MMU plays a very crucial role in bridging that gap, bringing healthcare directly to the doorsteps of those who need it most. The launching of this MMU therefore symbolizes hope, resilience, and the promise of the healthy future for the people of Kiphire in particular, but for Nagaland in general. We are grateful to the team Tata AIG, Swasti, and TA, your beliefs and your vision in the power of community-driven solutions, and your focus to underserved areas amplifies the spirit of corporate responsibility. In closing, may we all continue to strive for the healthier future for our people. Before I end, I would like to thank the Swasti and also the Tata AG for remembering the appeal that we have given on the first day that we launched the Zinaboto MMU. We are very grateful for that, and for which within no time you have given us another MMUs, but we also want you to remember that all our MMUs in other districts are also very old, which I think it is more than, which is around 15 years. So I think you will keep that in mind again. And also regarding the blood storage equipments, we have already discussed about that. I mean, we have already appealed, I think appeal should be the right word. Last time that as of today, we have only 3 blood banks which is licensed, and for which we are unable to, I mean, the blood storage, or we are unable to reach our criteria of licensing the other blood banks in the other districts. It is because the state is not being able to give things, the criteria which is required for that, trying our best to license the other areas, the other districts, because of the need for the other districts to also have a full-fledged blood banks, and also of course the blood storage units. So we are very excited and happy that you have already more or less you have done that part for us, and thank you so much in advance. And we hope that this partnership will continue. And with your support, we know that we will be able to reach out to the people who need it most. And so, thank you so much once again.
So, as all of us are aware, this is a kind of a symbolic handover of the keys for the second mobile medical unit. The first is already functional. This is a part of the pilot project in Zuneboto and rendered services Zuneboto and FIT. This is proposed in the district of Kiphire, the aspirational district in the state. And heartiest congratulations.
Good afternoon, everyone, once again. First of all, I thank the Almighty God for blessing all of us and also giving us an opportunity to receive a new vehicle for different districts. So, on behalf of all of us, and my own behalf, and the Department of Health and Family Welfare, I hand over the mobile medical unit vehicle key to the district authority.